on the topic entitled Diabetes, 12 Signs 10 Years Early. It means the 12 signs you see 10 years before a person or individual is diagnosed with prediabetes or full-blown type 2 diabetes. Diabetes is described as sneaky disease because it can hide behind the scenes and causing damage to your heart, to your kidneys, to your eye, that is the retina, and it can cause damage to your nerves, even 10 years before a person is diagnosed with the disease. Unfortunately, when you go to hospital and the disease doesn't reach certain threshold, or whatever they see doesn't reach certain level, they will ask you to come back. Let's see the 12 signs 10 years before diabetes sets in or is diagnosed officially. Number 1 is frequent peeing, especially at night, both men and women. Because high sugar, even you wouldn't realize that you have high sugar. You can be checked in a hospital. You may not have that high sugar, but your body is experiencing some kind of high sugar because of insulin resistance. Too much sugar will make your body actually pass that urine. Your kidneys will try to flush out the extra glucose. In doing so, you'll be peeing a few times at night, both men and women. Number 2, because you are dehydrated because of frequent urination, there's an alarm bell that will ring in your hypothalamus. That is a part of the brain that actually controls thirst. So it will tell you, the individual, to drink more water. So increased thirst is called polydipsia. So because it's not normal to be drinking water all the time in the day or feel thirsty all the time. So take note of that. Sign number 3 is increased hunger. It's called polyphagia. Increased hunger because you see your body is not making use of glucose. So once again, your body will prompt you, your brain will tell you, feed me, because your body cells are not getting the glucose for energy. So they feel hungry, but you have just eaten. So your brain will prompt you to eat again. Number 4 symptom is unexplained weight loss. You have an intention, plan to lose weight, but you're losing weight because there's no sugar or glucose in your cell for fuel, for that energy. So what happens? Your body will try to break down fat and muscles to get energy. But in doing so, that person will be losing weight. Number 5 symptom is fatigue. The person might have slept 8 hours but still feel fatigue. Why? Because of the insulin resistance. Your body is not sensitive to the insulin. And so you don't have glucose getting into your cells for energy. And of course, you're also dehydrated on top. And you have inflammation because high sugar causes inflammation. And so that will make you feel tired. Sign number 6 is blurry vision. Sugar is very sneaky. It can, hide itself in your eye and can damage and can cause the shape of your eye lens to change and cause it to swell, and also damage the blood vessels which supplies your retina, the back of the eye, and can cause diabetic retinopathy. So it can cause blurry vision because of that. Sign number 7, delayed wound healing. You may have a cut, but it doesn't heal so quickly because your immune system is messed up by the high sugar. And also, the high sugar will slow down your blood circulation with oxygen, and that can really reduce the time of healing of any wound. Number 8 is recurrent infections. You have infections more often. That is urinary tract infection and yeast. Because first, your immune system is messed up. Secondly, the sugar will feed the bacteria in and around your groin area. So that can lead to yeast and urinary tract infection. Number 9 is peripheral neuropathy. What does it mean here? You may have pins and needles and numbness in your feet and then in your hands, because the sugar will damage the covering of your nerves. It's called a myelin sheath that leads to pins and needles. This could happen even 10 years before diabetes is diagnosed. Number 11 is low libido in men, because diabetes will thicken the small blood vessels which supply blood to your pelvic area and also damage the nerves that supply critical for erection. So you may have erectile dysfunction. And high sugar may also lower your testosterone levels and lower your dopamine. That is a pleasure hormone. So you can see that a man may not have the desire. Desire is gone and no erection. So that is high sugar. If you're a man, late 30s, early 40s, you're having this problem, it's not time to go for Viagra. It's time to check your sugar. The last one, 12, is menstrual problems in women. High sugar may cause, or insulin resistance may cause problems with the hormonal imbalance, and that is with estrogen and progesterone, and then can cause cramps, irregular periods, and heavy bleeding and pain in women. It can also make the woman have fewer menses in the year, or no menses at all. So these are the 12 signs that happen 10 years before an individual is diagnosed with type 2 diabetes or prediabetes. I hope you've learned something today. If you have diabetes or any other chronic disease, call me on this number, +44 738 464 7300. Share this number, be a blessing to somebody. Also, if you are happy with what I'm doing, go to my YouTube channel. If you haven't subscribed, go there to be a blessing to someone by subscribing and sharing the videos there. Put in Dr. James Natural Link. Dr. James